Oh, I'm kind of running late, but oh dear. It's the start of a new school day, so good morning. So I have to run. God, I woke up early, but I was so busy last night because I had so many things to put together. Oh God, here we go. Start of a new day, new class actually. New class rotation, so yeah. Let me see, I've got my mask. Got my mask here. Let me start the car. Okay. Oh, I had that on. It's kind of chilly this morning. Okay. Okay, we're ready to go. Thank you, Lord, for a great new day. Yes. Alrighty. Liking my new look. All right. Okay. Yeah. So I'm just getting here. Thank God I had some parking today, because that's usually the challenge, having a place to park. So anyway, so I'm here now. Okay. Let's see how this goes. No, I'm touching the wrong thing. Okay. Getting ready to come out. Yeah. Okay. I'm packed okay. Yeah, I am. Oh, I thought I locked myself outside. Why isn't this thing working? Okay. All right. There you go. Sorry, my phone is all over the place. Have yet. I don't know how many students I have yet, but we're gonna find out. So I'll see you on the other side. Okay. About to get in my class. So I always tell my students this. When you get training, you have training wherever you work. Once you have training, well, you're covered by that place. Do you see what I'm saying? So you need to work. Do you see what I'm saying? Now, once you get certified and you go on to do your state test, then you're pretty much legit. Do you see what I'm saying? And also, you want to be sure of your scope of practice. You never go outside your scope of practice, because that's just asking for trouble. Okay? But however, if you have been trained by that place, like for instance, I've had people who work in hospitals, okay, and they do things like check blood sugar. Okay, yeah, I know. That's a skill, but they've been trained on doing it. You see what I'm saying? So there's certain places where they train you. Hospitals is pretty skilled. So they they do need people hands-on, and you're able to do stuff. So they do train their PCTs, patient care techs or technicians, and they haven't state tested. However, I do find what I'm hearing is they're going to start making everyone do the state test, which I guess it makes sense. You want to be tried and tested, and they know you can actually perform the skills that you've been giving and then giving credit for it. So in the nursing home, they do want you to state test before you do personal care. Okay, so chapter 1 tells you the nursing assistant in long-term care. Okay, so there are 2 ways you can see long-term care. It can be the length of the care, and it's also long-term care as in long-term care facilities. You know, not too long ago, I mean, even now, people still say nursing homes, and you'll hear me refer to it as nursing homes, but the more current way of saying it now is long-term care facilities. Okay, so one big thing you need to know about long-term care facility is that the people in there, the residents, we call them residents because that's where they live, more or less. They're there for the long haul. They require 24-hour skilled care. You got to know that. Okay, that's one thing that differentiates it from other care settings. Okay, people who are in the long-term care facilities need 24 hours skilled care. Okay, skilled care is ordered by a doctor, and it involves a treatment plan, and it involves people with skills to take care of that. Okay, so the next thing now we're talk about long-term care. We're talking about the length of stay. So Colleen, what is the length of stay? Pretty much that's it. It may be short or longer. Okay, usually after 6 months, it becomes like it's long-term care now. Okay, terminal illness, Nathaniel.
Terminal illness. This means that the illness will eventually cause death, or other people will recover and experience new homes or to other care facilities or situations.
Do you all understand that? Just because you've been termed terminally ill doesn't mean you're actually going to die. Have there been cases where people make a full recovery? Yes. In healthcare, something you are going to find is there are no absolutes. Miracles happen all the time, and I've seen it. People that have been written off like, this one isn't going to make it. They do make it, and they're still 50 years later flying a plane. Okay, that's an exaggeration, but yeah, people recover. So you need to know that, yes. Now, you termed that you're terminally ill, okay, but people recover from it. So now we move on to chronic. Christina, could you put your max so we can hear you, please? Okay, so who can give me chronic conditions? Who can give me like examples of chronic conditions? Okay, dementia. Okay, what else? Yeah, nice, impressive. Heart disease. What else? That is a chronic condition because it's something you're having to live with. Yeah. What else? That's good. How about hypertension? Diabetes? Congestive heart failure? COPD? Yes, we'll come across that later on. I can see Nathaniel wondering what that is a disease of the lungs, cardiopulmonary, no, I'm getting it, hold on, pulmonary obstructive, no, I'm just making this up, COPD, I don't know why I'm not getting that right now, but it's a new day, it's a Monday, it happens, it'll come to me. Excuse me. So, cardiac obstructive pulmonary disease. Maybe not. But anyway, pain. Pain is chronic. It's something I know about because right now I do have pain in my lower back. And that's one of the things why I'm getting away from floor nursing, because nursing will do that to you if you're in healthcare, you know. And why is that? That is part of it, but because we don't use proper body mechanics, which is something we're going to be talking about, I'm going to be harping on it because that's something they're going to be looking at in your skills. Okay, a lot of nurses, and when I say nurses, nursing department, which CNA is a part of it, we do a lot of lifting and transfer. And in the work world, you find that sometimes you're the only one. You have no assistance. Is it annoying? Yes, it is. So chronic conditions, at this point, I like to juxtapose chronic with acute. And you're going to find that in my style of teaching. Sometimes I will put it opposites together just to help you remember, okay? So for chronic conditions, they are conditions that you're not necessarily healing or getting healed from them. You are just managing them. So they're stable. Okay, so say for instance you have hypertension. That just means that you have to keep an eye on your blood pressure because it tends to run high. But you have a full-fledged life, you're living your life and you're having fun, okay? It is stable, okay? And then you're managing it, right? So now with acute is more sudden onset. It comes in suddenly and it's unstable. Does that make sense? So I'm trying to juxtapose them. So it's unstable. And then when it's unstable, it also means that it needs immediate attention. It's not something you're managing. So let's use hypertension, okay? So for hypertension, we all know about, that's another word for high blood pressure. So you need to take note of that. So we know, your blood pressure runs high. It does run high. Okay, that's not new. Now, say for instance, you go to work and this person, the blood pressure is way beyond the parameters for that person because everybody has their baseline, has their parameters. And then you notice this person also isn't talking, or maybe one side, they're slurring their words. Well, it's not stable anymore. This is different, okay? Usually this person is able to talk to you, this person is able to move, but now they're just not doing that. So that means something is going on. It's turned acute now. It's become unstable. So let's use something else. So what that means when they become unstable, what do you do? What do you think what should happen to that person? Unstable means you need to make them stable. You ship them up to the hospital. They got to be stabilized. And that's what the hospital is. It's acute care. Okay, that's why you don't have people recuperate in the hospital. In the hospitals, you go there, they get your vitals and they get everything right or as close to, right as possible, and then ship you back out to go to a place to recuperate. Okay. So let's use something else. Let's see, someone with congestive heart failure, or let's do COPD. COPDs are people who have oxygen challenge. Breathing is a big thing for them, and usually, not always, but usually it's things that smokers suffer, okay, because their lungs are damaged. So their lungs are not functioning at 100%. So their lungs could be functioning as low as 20%. Give me a minute. And what happens is, so they struggle to have the oxygen, okay? You find them, they're always with oxygen. And even at that, it's still not enough because, again, the lungs have been damaged. So you find out, okay, so we know he's on oxygen. We know this person is short of breath sometimes because they're trying to get all that air in. Okay, so that's not new. That's stable. It's chronic. Something he or she's going to leave with, And then you turn up for work. You find this person spiked a fever. You find this person now is clutching their chest. okay, that's new. That's now acute. This person isn't stable anymore. Does that make sense? Because I try to do this just so, when you hear chronic and you hear acute, you now kind of get it. Like, oh, okay, the opposite. So sometimes I do that just to help you. And then again, someone's clutching their chest. The next thing you want to do is, okay, this is different, So you want to take them to a hospital where they will be stabilized. Okay, Nathaniel, you had your hand up. Yeah, asthma is, it is, and that's, there are people who, go through life, they have asthma, but then when it comes to a point where they become short of breath, they can't breathe, they're passing out, then it's no longer stable. But yeah, asthma is chronic. That's a good one. That's a very good one. So we go on to diagnosis. Marie, what is a diagnosis? Thank you very much. Do we diagnose? We as in the nursing department. As a CNA, you don't. As a nurse, you don't. Only doctors diagnose. You need to know that, okay? You'll be asked questions like that. Now, on page 2, we have different care settings, and they're pretty much self-explanatory because we have home health care, okay? And that just pretty much tells you they are being treated in their homes, okay? Now there's a question, listen very carefully. Can we have long-term care in a home health care setting? No, it's not different. I mean, hospice care, can be in a home health care setting. So is that a yes or a no? I just want to know. Do you all know what long-term care is, right? So is it possible to have that in a home health care settings? Yes, very good. It is. Okay, because there are people, again, if you go to the hospital for whatever reason, let's just pick another patient. Say, for instance, this patient had a limb removed. That's long-term now. They're not going to stay in the hospital until they heal. They can go to their home. They don't necessarily have to go to, and sometimes it's in steps. They go to rehab before they go home. But sometimes they go straight home. So in a home health care setting, you will have long-term. You also have short-term, okay? Assisted living. Assisted living, I like to juxtapose that with long-term care facility. Remember, there's long-term care and there's long-term care facilities, okay? So assisted living, the difference between assisted living and long-term care facilities is that in assisted living, they don't require 24-hour skilled care. That's a big difference. You should know that. Okay. Has anyone worked in assisted living? Probably not. Okay. So assisted living, pretty much, these are patients or residents, again, because they live there, we call them residents. And what that means is that they can do for themselves, or they're expected to do for themselves. They can, a lot of the ADLs, which we're going to come to, activities of daily living, they can toilet themselves, they can sometimes wash themselves. Some still drive very well, they go on dates, they go to dinners, because it's assisted, okay? So what you're probably doing is helping them to make doctor's appointments, reminding them to take their medication, making those appointments for them to do their hair and what have you. They're not dependent on you. I mean, that's what it should be. Now, in the real world, is that how it is? No, not really. Sometimes they really should be in long-term care facilities. because they become really dependent on you, where you're having to do everything for them. Do you know why sometimes it's that way? Why they remain in the assisted living facilities as opposed to going to long-term care? Someone just guess. You don't need to know. Just guess. Can anyone guess? Yes, ma'am. It's the money. Ding, 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 ding. It's the money. It's cheaper to remain in the assisted living. And a lot of times that happens until, too many accidents happen and they're like, okay, we can't cover this anymore. I mean, come on. It's become too obvious that now you're a danger to yourself and to others. Okay? So yes, it's the finance, and I get it, So we have, so you need to understand assisted living, okay? Adult day services. Now, when I talk about adult day services, I tend to compare it to child care services, as in, kindergarten, not kindergarten. What's the other? Christina, what do you call, I'm forgetting words today. Daycare. Okay? Now be careful. I'm comparing that. I'm comparing adult day services, but they're not kids. You have to be very, very careful of that, okay? But I just want to compare it. It's much the same way as a daycare in that, parents drop off their kids, and pick them up from, when they're coming back from work, because you don't trust them to be by themselves at home, because now they're not functioning at the level they were. So it's the same thing with, that's how it is for the older folks, okay? So they have these adult day services where they go to socialize, where, it's like going to school. It's like going to a club, not school, like a social club, okay? Where their caregivers will, have them go, either because they're at work or sometimes it's just respite care. You don't want to, because there's such a thing as a burnt out. You're going to get burnt out. Has anyone ever cared for a sick person for long term? Okay, I have. It will burn you out. That was my mom. It will burn you out. So sometimes you need respite care. And you're going to find, I told you guys, I tend to personalize things just to put things in perspective for you. Okay, so acute care. Now you all remember we talked about acute care, so that's what you all remember what acute care is, right? 24-hour skilled care given in hospitals and ambulatory surgical centers. So we've talked about acute care, right? Okay, it's skilled care all the way. It's got to be skilled. Okay, then we have the subacute care. Now, subacute care is like a step down from acute care, meaning they're stabilized, but they're not altogether out of the woods. Does that make sense? And a lot of times you might have a floor or maybe a wing in a hospital. I think that's becoming trendy now. But before this trend, usually most subacute care will be like in a long-term care facility. So you find if you work in a nursing home, you'll find a floor called a rehab floor. So that's usually where people go to after they've left the hospital to recuperate. So in places like that, you're going to find physical therapists, because again, these are people trying to help you bring you back to normal or as close to status quo before whatever happened to you happened. So you're going to find the physical therapist, the occupational, the speech. You're going to have nurses, working around the clock, again, because they're trying to bring you close to how you were. So you find people also on IV therapy, all that's all skilled, Sometimes it could be a wound dressing you have. So all this care, subacute, is like rehabilitating you. Okay, it's rehabilitation. So all that, again, you're not so unstable to be in an acute care, but you're stable enough to be to still be taken care of, until they bring you back. And then you have outpatient care. Can anyone give me an idea of what an outpatient care will be? An example of an outpatient care. Nathaniel.
Maybe to the doctor or something.
That's outpatient care. Sometimes outpatient care also needs surgery, same day surgery, by a dentist. So no, that's outpatient, okay? So, but that's, yeah, you're right. So that's outpatient care. It says usually given to people who have had treatment procedures or surgeries, any short-term skilled care. So you're just going in there to have your wound dressed, taken care of. Do you see what I'm saying? Or teeth cleaned or removed, stuff like that. Or even people go for laser eye surgery, cataract. That's something my mom had, cataract. It was the same day. She didn't stay overnight. Okay. Then we come to rehabilitation. Rehabilitation is care given by specialists, which I already talked about. Rehabilitation is in subacute care. Does that make sense? Okay. And then we come to hospice care, something Colleen had talked about. So, Colleen, what is hospice care?
It's given to people who are about 6 months or less to live.
And that is so true. And I can tell you right now, once you're like a day over that 6 months, they're taking you out of it.
We have a little lady, she's 98. She's been on hospice like 3 times.
Yes, they take her out, they put her back in. I've seen that too. Yeah, it's true. It is so true. Now, another question I'm going to ask you. So, if you are in hospice care, does that mean that you are going to die? I mean, it's believed that you are dying. However, people have been known to recover. So, having passed through this class, if you don't know anything else, you must know ADLs. That's on your page 3, activities of daily living. You've got to know activities of daily living. And this is what I tell my students. If you don't remember, think of what you do every day. So what are some of the things you do every day that you need to be doing every day? Shower is one. Eating, okay. Yeah. Walking, talking, okay, watching TV, using the bathroom, okay. Those are all activities of daily living. That's what I tell my students. There's no need to I've got to memorize. No, it's what you do. And that is why it's so important that you get skilled in helping these people, because that's the bane of your work. Helping these residents or clients to perform activities of daily living. Because of what they're going through, sometimes they're not able to. It could be temporary, it could be permanent, that they need you for as long as, necessary. Okay, so you need to know that. Activities of daily living, ADLs. So talking about ADLs, another thing I'm going to point out is residents' rights. Now you find all over your book, it is carded all over your book. You're going to see those little blue boxes, and it's talking about residents' rights. Always look at things in the boxes, whether blue, yellow, green, it doesn't matter. Always look at them, okay? Because sometimes your questions will come from that. This is just moving forward. You go into nursing or medical school, wherever. Look at those things in the box. Sometimes your questions will come from there. So that is Nurse Amy Cookie Points. That's another thing you're going to get used to hearing in my class. We talk about cookie points. You all know what brownie points are. So cookie point is just something I coined. So anyone who's been through my class knows Nurse Amy Cookie Points, okay? So that's a cookie point for you right there. Always look at those boxes. So, cookie points, residents' rights. If you do not know what residents' rights are, what rights do you have? They have it too. Does that help? Yes. So there's no need to, oh my God, what are the rights? No, if you have the rights, they do. Okay? So another thing we're going to be talking about is Medicare and Medicaid. So I need you to know what those two mean. You got to be professional. You got to have boundaries. Why? Keep things moving smoothly. Okay. Yes, that's Very true. You don't want to lose your job. What else? So there are no bloodlines blurred, you know your place, they know their place. Now, I find this a lot of times with the nursing aides. Now, nurses suffer from that too. You think that your patient is your friend, okay? I'm not saying don't be friendly. They're not necessarily your friend or your confidants. And I find aides, the reason why aides, I think, at least in my own experience, aides do that, because you're the one that is around them more often than not, okay? And then you form a friendship. Now, forming a friendship, there's nothing wrong with that. It's you now taking them into confidence, and then you begin to swap stories. There's a problem now, okay? Because then becomes an over familiarity, and not even that. Whatever you tell them, well, you just be rest assured it's probably going to be heard elsewhere. Okay, so then you have those, is no longer professional. You've marred the lines. Okay, you want to be careful of that. So always be professional. Okay, there are things they will tell you now because we're friends. They don't expect you to divulge. Well, if your patient tells you, I'm being abused, abuse is something you got to report. Okay, and in the state that we live in, is mandated report. Okay, you got to report it. Okay, but because you're friends now, this patient probably doesn't expect you to, because it just says our secret. Okay, also another thing that happens is you begin to exchange, please don't do this, gifts, money. Yeah, like Nathaniel said, you're going to lose your job. And not only that, there might be consequences. Okay? And then again, when you're not professional, sometimes people read meanings into it. It could become sexual. Now we're walking on thin ice. Now you might not be returning those feelings or emotions. Well, that's you. They probably feel that way about you. You see what I'm saying? You got to keep it professional, okay? People pay you compliments, thank you, but do your job and keep it moving, okay? Another thing about professionalism, which for me, is just one of my pet peeves. I can't stand it when people go into such terms of endearments like honey, sweetie. I think it's rude. I think it's condescending. I think it's patronizing. Even when I go to the restaurants and people talk like that to me, it irks me. I don't like it, Now I know sometimes for some places, it's cultural. Well, you're in the professional world. You got to let some things go. Something I have found out, and I have shared that with my class, and have started to do that with aides that I work with, even nurses. Sometimes you find some residents are resistant to care, and they're just combative with you. And you're wondering why, but somebody else comes in that probably addresses them properly, and they're more receptive. You see what I'm saying? So you come in like, no, honey, oh, darling, you can't do that. This person feels disrespected. Again, the people you're going to be with come from different cultures and different era. You got to take that where it was polite to say, ma'am, sir, miss this, Mr. this, okay? And then you're going like, oh, honey, she's not your honey. He's not your darling. You do see what I'm saying? And then when you go, they resist you because that's the only way they can show their displeasure, And somebody else comes and say, Mr. Jones, do you want this? Like, oh, somebody who has some manners. They're not going to say that because they can't say it or they don't want to say it. But you need to be very careful about things like that, because I started thinking, I usually don't. I've had patients refuse care from me. Yes, but it's not from me being disrespectful. I'm not. It could be from, well, let's just keep it real. There will be people who see a different color and do not care for your care. Okay? So it could be black or white. A black person could refuse the white person giving them, because again, it's not your problem. Don't take it personal. And you're going to find things like that. You just keep it moving. Keep it moving. Find somebody else. Change assignment. They have a right to refuse care from you. Okay, so it doesn't matter black, white, don't buy into all that. You just, again, you want to keep your job. Okay, we live in different times where people need to be very cognizant and respectful of what people want and their boundaries. Okay, so you're going to find things like people of LGBTQ, the people of different religion, different faith, different whatever. Okay, it's not about you, it's them. You do your job, go home to your family, okay, where you can freely express your views. All right, I always say that because I have had students who think that they can't do it because it's not part of their beliefs. Well, too bad, you can't work anywhere in the world. I can just tell you that right now. It's not just healthcare, okay? Yeah, I've had a student say, "Oh no, I can't address people the way they want to be addressed if it's not how they were created." Anyway, that's just an aside. Yeah, and we're like, okay, good luck. Stay in the house. It's not about you. We've all got our faith. I've got my faith. I've got my beliefs. I've got my value system. Deal with it. Okay, so we have on page 9, we have compassionate. You as a nursing assistant have to be compassionate. What is the difference between empathy and sympathy? Technique for getting your gloves on. So put on your gloves. Already. Okay. So, are there any left-handed people here? All right, the only reason why I ask is use your dominant hand. So I have had left-handed people sometimes struggle. Just use your dominant hand, okay? So I'm very right hand, my right hand dominates. So you go in like so. Now what I do is I try to free up my gloves, but you're gonna actually pull from the middle. You pull it and you contain it. You pull it and you contain it in your hand. And then you go in either with your thumb, which I do because that's just how I do it, or you go in with 2, or it doesn't matter. But the thing is, you don't want to touch the surface. So you go in and you pull this. And what I do, I immediately turn it upside down, cookie points, because I don't want to touch this part. Okay, so I'm going to redo it just so you see it, then I'm going to go check everybody. So again, put your gloves on again. So first thing in your mind, you just want to assume that these are soiled gloves. They're soiled. So imagine that you've got urine or you've got poop on your gloves. So what that means, have that in your mind, that will help you. So what that means is you certainly don't want any soiled glove touching your skin. So just go in with that mindset, okay? So we've got poop, we've got pee, we've got vomit, whatever works for you. And then you're gonna go in because you need to take this off. So soil to soil, clean to clean, okay? So moving forward, even when we're using the PPE, you need to always have that at the back of your mind. Soil to soil, clean to clean. So I'm gonna go in here. If it's a bit snug, free it up a little bit at the tips. And then you pull, okay? You go ahead and pull. Now remember, this is clean. Soil to soil, right? So you contain it. And then I'm gonna go in. Remember, all this is clean now. I can touch here, but I can't touch here. So I'm gonna go under the glove. I'm gonna go under the glove. And I'm gonna make sure this hand doesn't come this way. Okay, because again, this is all soiled. So I immediately turn it upside down because I don't wanna touch the soiled part. I wanna keep my hands clean. And that's all there is to it, okay? So you all are gonna show me what you're doing. Okay, I'm going home. Thank God, I'm so happy. It's time to go home. It's the end of school and I'm happy. Okay, I've got to walk to my car, but all in all, it wasn't bad. It was actually good. It was a good day. have a small size class, which I'm happy about. And I'm just happy. We've got a new set of skills, which I'm going to have to figure out. But it's not so bad, actually. It's just combined skills. So, okay. Long day. But worth it. Oh my God. I had to take my gloves off. Not gloves, my oh dear. My mask so I can breathe because it's been on and off inside. Okay. So let's quickly talk about it. So how was my day today? It wasn't bad. It was just let me take this off. So I'm getting ready to go home. It's been an interesting day, interesting in a good way. I have a small compact class, of which I'm really glad about. Students ready to learn. Not a lot of them have been out in the field. I have had those before, and it's fine. You know, we all get on the same page before it's over, before the program is over, so we're fine. But I do find that students who have worked in the field sometimes struggle, because there is a work world and there's a book world, and it's different. So check out my videos. So having said that, so new skills, more like combined skills. Right now in the state where I teach, there is not hand washing is not a standalone skill by itself. It's combined with other skills, and from what I'm seeing, skills that have to do with pericare, perineal care, the genital area, adult brief, skills that have to do with, body fluids, you're dealing with urine, that is combined with hand washing. And then skills that have to do with feeding, mouth care, and partial bed bath, that they combined with PPE, personal protective equipment. So that is what I see. That's the difference right now. So this class I'm teaching, they're the guinea pigs, if you will, of this combined skills, because anything after October 1st, that's what they're going to be tested in the state that I'm teaching. So it was kind of nice. It was nice just to try on those new skills. So even if you're watching my videos, those skills still work. It's just that things have been added to them now. So you still need to know how to hand wash, okay, the right way. 20 seconds in, interlace your fingers, get your fingertips, because at the end of a skill, say like bedpan, you are going to be washing your hands. So it's combined. So hand washing is not a standalone skill. So PPE is the new thing that was introduced. Initially, that wasn't part of your skill. So now if you do partial bed bath, you are going to be putting on your PPE equipment. So that's something also, I have a video on it, and you can watch that. But I'm going to be bringing more just so we're current, because that's something that actually influenced my coming on YouTube. There were not current videos for my students, and you know how I love my students. So pretty much that's it. I'm looking forward to what the days ahead bring, trying these combined skills. The one thing though that I'm kind of concerned about, they have combined the skills. However, everything still needs to be completed at 35 minutes. So I'm not exactly sure how that is going to work, because one of the skills, adult brief, you have changing adult brief plus perineal care of a male resident plus hand washing. That's 3 skills in one. So I'm kind of curious to see how that will play out tomorrow, because I will do that tomorrow. But these new students don't even know what the older type skills was, so it doesn't really matter. But my skills are still there. You go ahead and watch it, and once you know hand washing, adult brief, the one thing that's new though is doing perineal care on male patient. That's new. So we've always done the female. Now the female perinatal care is still there, but now they've added male. So again, thank you. I thank you so much for your support. I thank you for tuning in. I thank you for the love you've shown me. My students, thank you. And those that have not actively been my students, but you have written to me because someone has referred my videos to you, or you probably saw someone mention me. I don't know, but I have people writing to me. Thank you so much. Your support means a whole lot. You have no idea. It means a lot to me. It inspires me to keep giving. And for those of you that, I actually have 2 people now. They were not in my class, but I'm actually coaching them through even the CNA program while they're currently in right now. And then one has actually gone on to do her state test. She passed it, yay! And another right now has just graduated CNA school, and I'm coaching her through, until she takes her state test. Things like this just it humbles me. So thank you. If you have not subscribed to my channel, please do so. Your support means a lot to me. And for those of you who have been there, thank you. Please comment, share my videos, subscribe. I need to get to 1,000 subscribers. And it will mean a lot to me, you just coming along this journey. So thank you. I'm actually going to go home now. It's been a long day, but I'm hungry. I want to go home. And so until I come your way again, like I tell everyone, remember, you have the power. You can limit yourself. Do not do so. Okay, I am your biggest cheerleader. So until I come your way again, please be safe, be kind, and be blessed. Bye.